Healthy foot X-ray, normal foot X-ray. Normal foot X-ray. A healthy foot X-ray is an important tool for identifying bone problems. It can be obtained in two different views, a medial lateral view and a dorsal plantar view. A doctor can use an X-ray to assess the condition of bones and to determine whether they have fractures or avulsions. A floaty, rounded, or curved part on the X-ray might be an ossicle, or even an ossicle. An X-ray can reveal a variety of bone abnormalities, including osteoporosis and bony growths. Children's feet have a special region that requires a routine X-ray, the medial border of the cuboid. Unlike a regular X-ray, foot X-rays are very safe, but there is always a risk associated with exposure to radiation. Normal foot X-ray. Although the amount of radiation is low, it is important to tell the X-ray technician if you are pregnant or breastfeeding. Also, if your child is going to have an X-ray, explain what will happen and why. Your child's X-ray will go much more smoothly if you explain to him the reasons for the test. An X-ray shows the structure of your foot in black and white pictures. Hard, dense structures absorb lots of X-rays. Soft, elastic tissues, like muscle, allow more radiation to pass through. These images are important to diagnose broken bones and dislocated joints, as well as arthritis and joint deformities. If you're having general foot pain, swelling, or tenderness, a foot X-ray may be needed to identify the source of your discomfort. A foot X-ray is a safe procedure, and it does not pose any health risks. Normal foot X-ray. While a foot X-ray does involve exposure to radiation, it is not harmful. The X-ray technician uses only the amount of radiation necessary to produce the best images. A pregnant woman should tell the radiologist if she is pregnant or breastfeeding. A child should be prepared for the procedure by explaining the process and the potential consequences. X-rays are safe for pregnant women. The amount of radiation received is too small to cause any harm to an unborn baby. It is important to tell your doctor if you are pregnant or breastfeeding. You should not be afraid of foot X-rays. They can help you decide whether or not to undergo an ultrasound. If you're pregnant, a foot X-ray may indicate fetal abnormalities. While there is no specific preparation needed for a foot X-ray, you should consult your physician if you are pregnant. The radiation from a foot X-ray is very small and will not cause any harm to your baby. However, if you are breastfeeding or are pregnant, you should tell the technician to tell you. You can prepare your child for the upcoming X-ray by explaining to them that the procedure will take place at a pregnancy-friendly location. It is essential to inform your child of the procedure and any possible risks. Normal foot X-ray. Older children should be reminded to stay still during the X-ray. If they're not comfortable with the procedure, parents should tell them it's perfectly normal. In fact, they will be surprised to learn that their feet are healthy and are not prone to disease. It's important to explain the X-ray to your child before the procedure. Although the radiation from a foot X-ray is extremely low and is safe to receive, it is important to discuss the results with your healthcare provider. A pregnant woman should tell the technician that she is expecting. Otherwise, the pregnancy can cause radiation in the feet. If your child is undergoing a foot X-ray for the first time, call your doctor and discuss the findings. They'll be happy to know that your baby is not in danger, so it's best to avoid a painful or uncomfortable diagnosis. A healthy foot X-ray is not dangerous. There is no reason to be concerned about the radiation. You'll probably have a small amount of radiation, and it's unlikely to cause any harm. But, you'll be happy that your child didn't have to worry about radiation. If you're pregnant, it's best to let your doctor know, so he or she can prepare the child for the procedure. Normal foot X-ray. Normal foot X-ray. Normal foot X-ray.